All right, can you hear me? Good afternoon. Happy Indigenous Peoples Day. My name is John Bailey, and I am an enrolled member of the Muckleshoot Indian tribe. I am also a descendant of the Puyallup, Duwamish, and Upper Skagit tribes. I'm honored and thrilled to be here. I work here at Amazon in our worldwide sustainability team, and I'm also a founding member and board member for Indigenous @ which is Amazon's affinity group for Indigenous employees worldwide. In addition to our US chapters, we have chapters in Canada, New Zealand, and Australia. And I'll tell you a little bit why I've been asked to be here today. I've been invited here to deliver a land acknowledgement ahead of today's important work. So let's begin. I'd like everyone to just take a moment to stop and think about their favorite place in this city, or maybe even this state. Maybe it's a family visit to a lake, a favorite hike that you like to do, or a camping trip on the Pacific coastline. Now imagine that you are there in that place right now. Those happy feelings may come to you. Remember it. That is what it's like for Indigenous people. We have always had a sacred relationship to place. I'd like to acknowledge that we are gathered here today on the ancestral lands of the Coast Salish people. The city of Seattle's territory is home to the Duwamish, Suquamish, and Muckleshoot Indian tribes. The Muckleshoot, which I am an enrolled member of, is a federally recognized tribe, and they have historically lived throughout the areas between Cascade Mountains and the Puget Sound, what is now known as the Coast Salish Sea. Muckleshoot is a party to both the Medicine Creek Treaty and the Point Elliott Treaties. These treaties reserve governmental rights to the Muckleshoot people and recognize their usual and accustomed places and territories where they hunt, fish, and gather, trade, govern, and live. These areas include what is now known as the city of Seattle and surrounding region. Today, Muckleshoot celebrates and honors their culture in practicing and preserving their traditional language and heritage. They're also educating their youth, providing housing, healthcare, veteran resources, and many other vital programs for its members. Muckleshoot remains a sovereign nation and are invaluable contributors to our state history, identity, economy, and culture. On this Indigenous Peoples Day, let's honor America's first people and the tribal nations that continue to thrive today. I'd like to encourage everyone to celebrate and recognize the many Indigenous communities and cultures that make up this country we call home. And I have the distinct honor and privilege to introduce our mayor for the city of Seattle, Mayor Durkan.
Thank you so much, Jonathan. I want to thank you, everyone, for being here. Good afternoon. Thank you for being here on Indigenous Peoples Day, and Jonathan, thank you for letting us just have that moment to settle in, to remind us of a favorite place, because it has been a hard 19 plus months for the city of Seattle. We are really excited though today, in the face of what has been just a determined predator, the COVID-19 virus. We are even a more determined city that knows we have to not just meet that virus, but recover. And we only do it through robust partnerships, caring for each other, and thinking, how can we move forward to the next place? Today, this is going to be an announcement that the city and its partners plan to ensure accessible and free COVID-19 vaccines for residents and workers here in the city of Seattle moving forward. Seattle's made incredible progress on this front, and we continue to be one of the most vaccinated cities in America. In February, when I set out the goal for our city to be the first to reach 70% vaccinated, Many thought it couldn't be done because at that time the city of Seattle itself had no access to vaccine. But we knew we could do it if we joined partnerships, came together, and we knew the people of Seattle would step up, and they did. As we head into the colder months and additional groups become eligible, it's so important for us to have the vaccine and booster shots available to keep us safe. We know there also has to be a continued focus on equitable vaccine giving, because if we don't focus on that, we know that we will have some of the same disparities that we saw before. So proud of our city's work to really focus on giving and setting up clinics in an equitable fashion, working together with our partners. I want to thank Amazon for having us in this space, but just as importantly, since the first day we learned about the pandemic, Amazon has been a partner leading the way to say, how do we keep the city safe? First, one of the first companies to work from home, which was the first thing we all had to do to stop the virus in its tracks, to find ways through the pandemic to give vaccinations, and to be one of our partners that we announce here today. We know that we started our focused efforts by reaching out to our most vulnerable neighbors, homebound seniors, where they are still bringing the vaccine was the difference between life and death. Then we expanded to launch 5 vaccine hubs throughout Seattle, including the largest civilian-led vaccine site in the country at Lumen Field. And I said it then, it was one of the happiest places on earth, happier than Disneyland. It was an amazing endeavor that took hundreds and thousands of volunteers and collaborators and partners, healthcare workers, people to give the vaccine. And they're the ones that helped us reach that 70% of our eligible residents fully vaccinated. In total, we administered 260,000 vaccinations in just a few months. And nearly 50% of the people the city of Seattle vaccinated identified themselves as from BIPOC communities. It was a remarkable endeavor and one that served as a model for the nation. But we know we're not done, because the virus is not done with us. We have to continue our efforts. This fall, we will be relaunching elements of our vaccine infrastructure to ensure there is easy access for unvaccinated workers, kids 5 to 11 years old once they're authorized, and vulnerable adults eligible for a booster shot. Beginning October 23rd, the city, Amazon, Swedish, and Virginia Mason will open a high-capacity COVID-19 vaccination hub right here at the Amazon Meeting Center. The downtown vaccination hub will operate Saturdays and Sundays from 9:30 to 3:30 nearly every weekend over the next several months. You can walk right in. This is a drop-in. You don't need an appointment. And you get your first, second, or your booster shot. As soon as Pfizer authorizes kids 5 through 11, you can bring them here as well. And as you'll hear later, probably, we also have other plans working through the Department of Early Education and Seattle Public Schools once other kids are eligible to work with them. We're also relaunching our Seattle Fire mobile vaccination teams, which has been one of our most successful tools for reaching our most at-risk community members. And again, Seattle led the way. Firefighters stepped up, got certified, became one of the front leading edges of our fight against COVID, and you saw cities throughout this country duplicate those efforts. They'll soon expand their mobile efforts to reach seniors eligible for a booster and historically underserved kids and families. You don't need proof of insurance or identification to get vaccinated at the downtown hub or through our mobile teams. Our goal is to keep this as low barrier as possible. In the next 2 weeks, the city will announce its plans for additional community hubs in South and West Seattle. We want to make sure, again, we're getting to those neighborhoods that have the communities that have been so disproportionately impacted by COVID, economically and health-wise, and the West Seattle, which has hard time mobility. So we have plans to bring clinics to those areas as well. I have to say, we would not have made it as far as we've made it and done so well without great collaborations and people willing to step up to do the right thing, to keep themselves safe, their families safe, their coworkers safe. I'm particularly grateful this morning for our partners at Amazon, Swedish, and Virginia Mason for working tirelessly over the last few weeks to launch this clinic. It is not an easy undertaking to launch a clinic of this type, but it is going to be such an important and critical resource for our city to keep that edge against this virus. I also have to give a special shout out to Renee from Swedish, who you'll hear. She was the clinical mastermind behind Lumen Field. Many of you saw her many times. She seems to have been cloned and done many roles because Renee was always there. Started with the clinic at SU, helped us set up Lumen, but I think she is really a sign of the commitment that coming together, healthcare providers, city, county, first responders, and most importantly, the businesses and residents of Seattle working together, that we can get through this and we can beat it. As always, I also have to thank Fire Chief Scoggins and Lieutenant Brian Wallace, who is here today, who you talk about, for their tireless commitment to being innovative, to pivoting, to figure out how they can serve what was needed. Even with their constrained resources, we know that they have done all they could to make sure that the job of firefighter was reinvented. I'm really proud that the city again is recognizing, because the virus is not done with us, that we will continue in our determined fight against this predator, and we will deliver equitable and accessible COVID-19 vaccines and boosters for our residents and workers. I've said it before, I think until we reach 100% vaccination as a city, that we're still at risk. And we're a city where people come literally from all over the world. Remember how this started. Just one or a few individuals who had COVID-19 came into the city, and here's where we were almost 2 years later. So I have a message to everybody out there. If you are not vaccinated, please get vaccinated. This virus will find you. You're putting yourself at risk, your family at risk, and your coworkers at risk. Vaccinations are not just about protecting yourself. They're about protecting us as a community. And particularly, remember, the people who cannot get vaccinated yet, our young children who are back in school doing what kids do. And we know that they are at risk and that the disease will spread in schools if we're not careful. I'm really proud of the work Seattle Public Schools and the other schools in this area have done to keep our kids and families safe. And the number one thing every single one of us can do, make sure you're vaccinated, get the booster when you're ready. And now I'm so happy to have Renee come up and talk to you about how this clinic's going to operate. Renee?
Thank you so much for having me here today. Mayor Durkan, I really appreciate your comments. My name is Renee Rassilyer-Bomers, and I'm the Chief Quality Officer for Swedish Health Services. It is so exciting to be here again today as Swedish celebrates the opening of another clinic with the city, this time in partnership with Virginia Mason and Amazon. As healthcare workers, we've been on the front line of this pandemic since day one, and each shot we give is like therapy. It's really emotional for our teams, our nurses, our providers, respiratory therapists, and all those on the front lines. And we're so grateful for the community's support in getting vaccinated and keeping this work moving forward. At this site, we will be giving the first or second shots for those who are unvaccinated, and likewise, boosters for those who qualify in those high-risk groups. And hopefully soon, we will be able to give Pfizer shots for kids 5 to 11. I've got 4 children in that age group, and I'm looking forward to bringing them here. At Lumen, we were able to give more than 100,000 shots in a few short months. I'm excited that this work will happen together with these new partners. We recommend that everyone who is eligible to get vaccinated, please do so as soon as possible. We're heading into the flu-vid season, and we know that vaccination against both flu and COVID are imperative as our healthcare systems are run over with the Delta variant. Hundreds of volunteers, both clinical and non-clinical, have contributed their valuable time and energy thus far in these efforts. And numerous Swedish caregivers have also volunteered on their off hours towards these efforts. I want to thank everyone for all that they have done to help roll out vaccinations as safely and as quickly as possible. On behalf of our entire Swedish team, I want to thank the mayor for her tenacity and leadership in keeping this work moving forward. Thank you. And now I'd like to pass the mic to Katie Hughes, Senior Manager for Global Environment, Health, and Safety.
Good afternoon, everyone. Thank you for coming to Amazon's campus today. We are pleased to agree to the city's request to host at the Amazon Meeting Center a location for the downtown vaccination hub. Amazon is committing to do what we can to help deliver as many COVID-19 vaccines as possible. Our philosophy has always been to do whatever we can to get vaccines as quickly as possible to people as quickly as possible. This led to a great partnership with Virginia Mason Franciscan Health, the Seattle Cancer Care Alliance, Fred Hutch, State of Washington, just to name a few. During the first half of this year, Amazon delivered 80,000 COVID vaccines right here on our campus in partnership with Virginia Mason Franciscan Health. This partnership came together in just 4 days of planning and helped meet the need for publicly accessible vaccines in the Puget Sound region. Amazon also partnered with Fred Hutch, Seattle Cancer Care Alliance on their community vaccine program to help address health disparities and vaccine access inequities faced by BIPOC communities in King County. Amazon donated transportation and logistics support for more than 25 pop-up vaccination clinics in underserved areas of King County. We also provided call center surge support to the Washington State Department of Health's 211 call center. This system processed over 100,000 calls and eliminated wait times. This, of course, is in addition to the hosting clinics at our fulfillment centers, where we have vaccinated more than 500,000 U.S. Amazon employees. It was natural for us to agree to do this again at our Amazon Meeting Center. We want to thank our partners at Virginia Mason Franciscan Health, Swedish, and the city for making this clinic happen. We are excited to invite people back to our campus again to get the COVID-19 vaccine to help protect themselves and our community. We know this pandemic has been tough and has caused terrible loss of life. However, a bright spot has been organizations like Amazon, Swedish, Virginia Mason Franciscan Health, and the city working together on a common goal on behalf of our community. Now I'd like to turn it over to Dr. Chris Baliga, Medical Director for Infection Prevention and Control for Virginia Mason Franciscan Health. Doctor?
Thank you. And besides being the Medical Director for Infection Prevention for Virginia Mason Franciscan Health, I'm also a practicing infectious diseases physician who has had the horror and the privilege at the same time of caring for patients with COVID-19 since the beginning of the pandemic here in Seattle. We are very excited at Virginia Mason Franciscan Health to again be partnering with Amazon as well as the city, Swedish, and really anyone who would like to help get vaccines into arms of our communities. The single most important thing that we can do to help end the scourge, which is COVID, is to get vaccinated. At this point, pretty much everyone who is over the age of 12 should be getting a vaccine. And as we heard, I'm very hopeful that in the very near future, we'll be able to immunize those over the age of 5. And I too have children at home that I am looking forward to bringing here to get their vaccine. Because yes, they're at school, they're doing all the things that kids do, and I really think that they would benefit from a vaccine. Through our partnership here with Amazon, as well as with multiple other community sites, Virginia Mason Franciscan Health has delivered 350,000 vaccines throughout our region, which includes Snohomish, King, Pierce, and Kitsap counties. To me, it is exciting to see people, when they get vaccinated, as we heard, they're very happy. But I don't know if you ever, the other side of that coin is the staff members that are giving the vaccine are exceedingly happy. I know that many people at Virginia Mason Franciscan Health who would say that their efforts in administering vaccines for COVID has been the highlight of their medical career, and nothing makes them happier than to be contributing to the vaccine herd immunity in our community. We've made great progress to date, and I want to say, without hesitation, a thanks to everyone who has helped, and that's true for our staff at Virginia Mason Franciscan Health, that's true for the community, that's true for the many volunteers who have donated their time to do this, as well as places like Amazon that have been gracious in donating their facilities. I want to just put a plug in for, personally, for me, it is heartbreaking to see patients in the hospital with COVID, especially now. We don't have very many visitors in the hospital. They're there all alone. They're scared. Most of them will improve and leave the hospital. Some don't. Some of them stay. They go into the ICU. They get intubated, and unfortunately, some of them die. I can personally vouch that the vast majority of the patients that we see are unvaccinated. The vaccine is, again, the single most important thing that we can all do to try to prevent COVID. It's not just protection for yourself, but it's protecting those around you. So yes, you get the vaccine selfishly, it'll help protect you from COVID. But think about it, you're also protecting your loved ones, people at home with you. The person who then, if you're not vaccinated and acquires COVID from you, could end up in the hospital alone. You're also protecting your community. One of the things that's really exciting about this opportunity is that it is a walk-in clinic. You just show up. As the mayor said, there are no barriers. Please come, get your shots. They've got innovative partnerships with the fire department and other organizations getting those vaccines out to people that aren't able to get here. We have to remember that this pandemic hits all of us, but it has especially hit our communities of color. These are communities that have been impacted financially, they've been impacted medically. This is our chance to try to increase equity for the vaccine, get it out to everyone. Anyone who wants the vaccine, like they said, the first dose, the second dose, a third or booster dose, everyone is welcome, everyone should come and get the vaccine. I'm really encouraged by the numbers that we see with the vaccine in terms of its effectiveness. I know the vaccine isn't perfect, but it works really, really well. It'll keep you from getting COVID for the vast majority. If you're unlucky and you get a breakthrough infection, it'll keep you out of the hospital. If you're even more unlucky, more rare, it'll get you out of the hospital faster, and it greatly protects against the risk of death from COVID-19. Again, we thank everyone for their support, Amazon, the City of Seattle, and I'd like to now turn my mic over here to Lieutenant Brian Wallace from the Seattle Police Department. I'm sorry, the Fire Department.
Thank you, Dr. Baliga. On behalf of Fire Chief Scoggins, who couldn't be here today, I would just like to extend a heartfelt thanks to the people of Seattle. You have done an outstanding job of protecting yourselves and others by following the expert advice of our public health officials, and you've gotten vaccinated at a very high rate. So because of this, we have an enviable layer of protection here, unlike many parts of the country. We've saved many lives together, many thousands of lives. But obviously our work is not yet done. There's still many who need to be vaccinated or get their booster shots. So this last winter and spring, the Seattle Fire Department went to over 300 distinct locations and administered 157,000 vaccinations, including the ones that we did at our hubs at Rainier Beach and West Seattle. And as the mayor highlighted, these were largely given to people of color. As we prepare to once again work our way back through many of these same locations to give boosters, it's hard for me to not ruminate on the logistics of that, and I find myself thinking about the Valentine's Day snowstorm of this year. That weekend we were scheduled to give vaccinations at 19 different adult family homes, and when we saw how heavy the snowfall was going to be, we shifted from working in vans to getting all-wheel drive SUVs, so we didn't have to cancel on a single site. But what was really remarkable to me that weekend is that our teams figured out that during the 15-minute observation period, they could build a little tiny snowman for the residents and caregivers of those homes. So they did that at each of those locations, and at some of the places, they shoveled their walks. Those snowmen brought a lot of joy to the people that lived in those homes, and even brought some of them to tears. To me, that perfectly summarizes both the perseverance and the level of care that the women and the men of the Seattle Fire Department bring to our community. So the crisis isn't over, and we're not finished trying to help bring it to a conclusion. In these coming months, we're going to deliver boosters to the most vulnerable people we vaccinated last winter, and we'll work with our allies here in the city, the Office of Immigrant and Refugee Affairs, Department of Neighborhoods, and we'll also work with our trusted partners, hardworking partners in the community, people like Lake City Collective, who we're already planning to coordinate some clinics for children once that becomes approved with. So we still have a lot of shots to administer. We probably have a few more snowmen to build. And with that, I'd like to turn it back over to Mayor Durkan.
All right, if there's a few questions for me or for any of the people up here, I will be respond if they're to me and be MC if they're not.
Is there a specific data point or time frame that brought up remobilizing people into those communities?
So the question was there a specific data point that required us to remobilize this efforts? It was a combination of things. What has made us truly as successful as we have been, which is not to say that there hasn't been an enormous amount of suffering throughout this, was anticipating what was next. And we knew that particularly with booster shots and with a large cohort of people who suddenly we become eligible, that we would have to have more infrastructure again. We knew so many people got vaccinated in a short period of time at Lumen, but that means those people are going to be eligible for their booster shots. And so fortunately, we now have much more vaccine in the community. There's no shortage, and people have more places they can go. But we also knew that if we were not super intentional in having a collaborative partnership here and making it as easy as possible, we wouldn't meet our goals as a city.
Madam Mayor, a question for you and a question for the doctor as well. But for you, as you know, hundreds of Seattle police officers have yet to comply with the vaccine mandate. Now there's a call to allow testing as well as getting the vaccine. What do you think of that? Will there be enough officers available next week to keep us safe?
So first, I want to say I so appreciate the service that the Seattle Fire Department and the Seattle Police Department have given to the residents and businesses of Seattle throughout this pandemic. We have seen from the earliest days that some of the people most impacted by exposure to COVID, by quarantine, and then by sickness were our first responders. COVID is the leading cause of death for first responders across the country. I want to say that again. COVID is the leading cause of death for first responders across the country. So I am hoping that every Seattle police officer and every Seattle firefighter does what they have been doing their whole careers. Stand up and make sure they do all they can to protect the residents and businesses they serve and their coworkers. They're in vans together, they're in close contact all the time. They do not want to risk their own health and safety, the health and safety of their coworkers, or the health and safety of the public that they serve. We still have time. We have seen throughout this process that there is always a surge, a late surge. We've seen, for example, the Washington State Patrol now is over 90% have been vaccinated, where many were making the same predictions that there wouldn't be enough. So I have every hope and confidence that every Seattle police officer and every firefighter will do what they've been called to do, and that's serve the public and serve health and public safety.
Testing as an alternative?
Testing as an alternative has shown that it wasn't very effective. For example, if you look in the corrections department, in the Washington State Department of Corrections, they had a testing program early, and we still saw a number of outbreaks. And we saw both correction workers and people in those facilities get sick. Unfortunately, some lost their lives. We've seen now that testing is something that tells you you've got it. But by then it's too late. If you're a police officer or a firefighter, you've already exposed others to it. And so the best protection for every one of those officers and firefighters is to get vaccinated, and for every business and residents to know if they have that hard time, if there's that emergency when they have to call 911 and a firefighter or police officer walks in the door, maybe sometimes to give CPR or mouth to mouth, they are going to have full confidence that that person is vaccinated and has taken the steps they need to keep their loved ones safe.
A question for the doctor, if I could.
Yep.
Doctor, we've been seeing the number of cases peak and plateau, even fall some now that the the Delta variant is waning a bit. Is vaccination still urgent?
Vaccination is absolutely urgent. If you look at the rates of the Delta variant now, you're right, they're starting to come down, but they're awfully high. They're almost as high as they were at our prior peaks. I think of it as a slow burn going through the community. The Delta variant is just so much more contagious than what we saw even before. And, if you had talked to me back in February of 2020, I would be preaching the same thing if we'd had a vaccine then. It's still out there. It's just waiting to get you. We know that there are people that are just susceptible and prone to getting it. The best thing that they can do is to get themselves vaccinated. That's the best protection that we have. Still be smart, wear a mask, try to avoid large gatherings in close proximity. If you're sick, don't go to work, stay home. But the vaccine is the way to go. Everybody should get it. And I'll make a comment for police officers, anyone really in a public-facing role. It's your responsibility to not only protect yourself, but to protect the public around you, just like we do in healthcare. Getting a vaccine is the way to go. Testing, it's a surrogate. It's another thing that can be considered. It's better than nothing, but once you've got that positive test, you're presumed to be contagious for 2 days prior. It's a whole lot better, it seems to me, to try to get vaccinated and protect yourself from ever getting sick in the first place.
Question for the mayor, follow-up, I believe, on what Essex was asking. I have to imagine this is in relation to the letter sent by King County Councilmember Reagan Dunn to both your office and the office of Dow Constantine. He talks about concerns over, we have a public health crisis with the virus right now, but if we do see an exodus of law enforcement officers amid a surge of gun violence and other crimes this year, that we're going to have another kind of public health crisis on our hands. Can you comment on that at all?
Yeah, I have a lot more faith in our firefighters and police than Councilmember Dunn. I think that they will stand up and do the right thing, and we've seen that throughout this pandemic, and we've seen it in other industries. Certain airlines where a large number of employees said they weren't going to get vaccinated, but when they saw what the deadline was, they did, and now they're mostly vaccinated. We saw it with the State Patrol. So I have a lot of hope and confidence that when a police officer or firefighter reflects upon, why did I take this job in the first place? They will continue to do the things they need to do to keep their coworkers safe, the public safe, and their self and their family safe.
Come October 18th, a week from today, will we see firings taking place? Will there be wiggle room? What does the forecast look like? How immediate could we see action taken against those folks who have not submitted proof of vaccination?
There's a number of steps we take to employees that have not submitted vaccinations, and under labor agreements we'll be giving the things, but the deadline is when it is. And I will say again I believe people will make the right choice. Particularly our first responders, we ask them to do a lot of things in order to have the job they do to serve the public. Firefighters have to get vaccinated for hepatitis, for example. Police officers have to go through rigorous training, polygraphs to become police officers, a whole range of things that we decide you need to do that so you can do your job. And every firefighter and every police officer that gets either in whether it's a big rig or a patrol car, they want to know their coworkers and everything they can to protect them and their family. So I will, everyone has to make that choice for themselves. There will be individuals who choose that they would rather not keep their job. But I have confidence that we will see the most of people do the right thing. Follow-up question.
How much is people going to have to invest to start these initiatives?
I'm sorry, could you say that again?
Any estimate of how much the city is going to have to invest or provide manpower into initiatives?
So this will be financed through mostly the federal funding that we got, and we have marked about $2 million for this amount. But we, with the ebb and flow of this, we want to make sure we have what we need to get it done right. And anyone who went to Lumen Field, the logistical undertaking for that was phenomenal. I mean, you had to have uniform, hundreds of tables with hundreds of laptops, with hundreds, and thousands of volunteers. This is a smaller scale, but it still seems all that back office kind of requirement. And I can't thank enough all the people behind me, because they're like the tip of an iceberg too. Beneath each one of them are dozens, if not hundreds of people making things like this possible while still doing their day jobs. Have to do a particular shout out to our healthcare providers. You know, here we are almost 20 months into this. They are exhausted and they keep showing up to work. They do it time and time again, and it breaks my heart that they are being asked to do it, mostly now, for people who chose not to get vaccinated. And we've seen in local hospitals and hospitals across the state, people who have other injuries can't get served because the hospitals are full with people with COVID. I have friends who've had family members suffer catastrophic injury or illness, and they can't go see them because of COVID protocols. We have the power to stop this virus. And so I'm just asking every City of Seattle worker, every resident, every business, do it for yourselves, for your families, for your communities, but think about those healthcare providers, the hours they've spent trying to keep families together. Thank you very much.
Mayor, real quickly, one separate question. There was an unsheltered person who died at the Ballard Commons last night, we have confirmed. Does your office have any timeline as to when comprehensive outreach will take place there to get people into housing, or what has been done in the past regarding that particular area?
So we have been working with the Ballard community and with the resources that we have, and have been slated to begin outreach already. We've been doing some outreach. As you know, that was the first area addressed at the beginning of the pandemic, and we have been working assiduously through some of the larger encampments that we have here, as well as some of the large RV groups. And so I don't have that exact information for Ballard what the timeline is at, but it's soon. We've been working with the community to see how do we make sure that we have both the outreach, but that we have places for people to move. One of the biggest logistical hurdles we've had is we have far more people living unhoused than we have places available for them. And so we've been trying to do the outreach, bring people inside, but that also requires us to have places to bring people. And our service providers who staff those places themselves are tapped out and are seeing the same impacts on their workforce that everybody else is. Thank you.